Nick Vogt was leading a platoon in Afghanistan in 2011 when 2 IEDs exploded.
It was myself and one of my soldiers sustained the blast the most. It was Specialist Calvin Peretta, who later died from the injuries.
Incredibly, Nick survived, but even after recovering from a traumatic brain injury and extensive tissue damage that required the amputation of both legs, daily life was difficult, and he was unable to sit upright for more than a few minutes at a time.
Because all he had was skin on his bone there, that's subject to breakdown.
It's like sitting on your elbows. It's just putting your elbows down, putting all your weight on it for a long period of time. It doesn't work. It's not a long-term solution.
Finally, Nick found Dr. Jason Souza, a Navy veteran and plastic surgeon at the Ohio State University Wexner Medical Center. He performed a 12-hour surgery that allowed Nick to comfortably sit up for longer periods of time.
They basically took a flap of just my skin, but also layers of fat underneath and the vessels, which is critical, and then basically put that where I needed the padding.
It's this kind of innovation that's needed to care for the thousands of veterans who survive their injuries but go on to live with pain and disability.
We say there's more to living than just being alive, and we are now focused on, with this military medicine program, thriving.
This includes procedures like those to reassign severed or damaged nerves causing chronic pain, and developing new types of prosthetics that reduce pressure and improve mobility. It also includes training combat surgeons and investing in research to continue to expand what can be done to give those who have given so much their lives back.
To be able to give back and use my skills to help somebody who's been injured or someone who has pain, I don't think they're great words to say, except it's an honor.
At the Ohio State Wexner Medical Center, this is Barb Consiglio reporting.